Metastatic hormone-sensitive prostate cancer, increasing in incidence, treatment options evolving, by Ed Weber, MD. Metastatic hormone-sensitive prostate cancer refers to cancers which are found to have metastasized at diagnosis prior to primary treatment, and therefore have not been exposed to testosterone deprivation. The incidence of this stage of cancer at diagnosis increased after the misguided recommendation of the U.S. Preventive Services Task Force to limit PSA testing in 2017. The occurrence will further increase as the sensitive PSMA PET CT scans evaluate men with intermediate risk and high risk cancers with 68 gallium PSMA 11 PET CT and the recently FDA approved Pylarify PET CT. There is general consensus that PET CT scanning with these agents is significantly more sensitive than the venerable, relatively insensitive standard CT and technetium bone scans. A wealth of evidence documents that the findings on these advanced PET CT scans substantially change the management of men with these categories of disease, often revealing that the disease has already spread to the pelvic lymph nodes and beyond the pelvis. The long-running European randomized PEACE-1 clinical trial began in 2013, with a now cumulative to date total of 1,173 men who have been studied. It aims at defining the optimal treatment for men with metastatic hormone-sensitive prostate cancer. The trial has evolved with a series of iterations in the comparator standard of care arm, which, for ethical reasons, incorporated the treatment schemas found most effective at an earlier stage of the randomized study. Prior to the findings of this study, androgen suppression alone, i.e., with Lupron or Degarelix, was the accepted treatment for metastatic cancer at presentation. Combination therapy with androgen deprivation and docetaxel chemotherapy. The pivotal study, CHARTED, or Chemohormonal Therapy in Metastatic Hormone-Sensitive Prostate Cancer, Sweeney et al. From the New England Journal of Medicine, August 2015, randomized 790 men with metastatic hormone-sensitive prostate cancer to ADT alone versus ADT plus docetaxel. The 6 cycles of chemotherapy were initiated at the onset of ADT. The study group was comprised of men with aggressive disease, 65% having a high tumor burden and 60% with a Gleason score of 8 or greater. The median PSA level at the start of ADT was approximately 50 nanograms per milliliter. After a median follow-up of 28.9 months, the median overall survival was 13.6 months longer with ADT plus docetaxel than ADT alone, 57.6 months versus 44 months. PSA progression was also prolonged in the combination arm, 20.2 months versus 11.7 months. Significant infectious complications occurred in 6.2% in the combination arm. Clinically significant sensory neuropathy occurred in 0.5%. This trial initiated the current era of combination therapy for metastatic hormone-sensitive prostate cancer. Although the study found that chemohormonal therapy conferred a greater benefit to men with high-burden disease, reanalysis of the STAMPEDE trial found the clinically significant benefit in survival for upfront docetaxel persists at longer follow-up, with no evidence that benefit differed by metastatic burden. N.W. Clark et al. Original articles, Urogenital Tumors, December 2019. The next step, adding abiraterone. As a result of several large, randomized trials, the addition of either docetaxel, chemohormonal approach, or an AR pathway inhibitor, such as abiraterone, enzalutamide, or apalutamide, is a reasonable standard of care option for men commencing long-term ADT for metastatic hormone-sensitive prostate cancer, as indicated by Kwan et al. From the World Journal of Urology, 2021. Kwan also cited that recent data from the STAMPEDE trial supports consideration of upfront docetaxel in all patients, regardless of metastatic burden. The PEACE-1 series built on this earlier work and then used the ADT chemotherapy arm as the standard of care and compared it to a triplet of ADT, docetaxel, and abiraterone. The data was presented at ASCO in June of 2021 by Dr. Karen Fizazi. At a median follow-up of 36 months, radiologic progression-free survival was 4.5 years for the triplet arm versus 2.2 for the doublet. The overall survival data was not sufficiently mature at the time. An important study finding was that the addition of abiraterone prolonged the development of castration resistance to median of 3.8 years as opposed to 1.5 in the ADT docetaxel arm. Although the final evaluation of the comparison between the doublet and triplet regimens awaits the data on overall survival, in discussing this trial at ASCO 2021, Dr. Fizazi, the trial's principal investigator, pondered whether the triplet therapy should be considered the new standard of care of metastatic hormone-sensitive prostate cancer. Selection of metastatic hormone-sensitive prostate cancer patients for doublet or triplet therapy. The remarkable benefit resulting from combined therapy as opposed to ADT alone supports the use of one of the tested regimens. The upfront docetaxel takes advantage of candidates' better physical condition to withstand the adverse effects of chemotherapy. Additionally, on a molecular level, docetaxel has been found to potential ADT by impairing the function of the androgen receptor. Zhu et al., Cancer Research, 2010. However, a patient's general fitness for cytotoxic chemotherapy needs consideration because of the hematologic and neurologic toxicity of docetaxel. Abiraterone is associated with an increase in hypertension and cardiac arrhythmias, and a 12 to 15% increase in any grade of hepatotoxicity. These adverse effects may limit the use of this agent in men with these conditions. Bottom line, as concluded by Kwan, the introduction of potent systemic therapy earlier in metastatic castration-naive prostate cancer has resulted in dramatic improvement in clinical outcomes for patients, notably the early 2.5-year prolongation of radiographic progression-free survival with the triplet regimen of ADT, docetaxel, abiraterone, and prednisone, 5 mg twice daily. Overall survival data is awaited. Additional research will likely yield further improvement.